Stroke first aid with ReadySF. A stroke is a medical emergency that occurs when the blood supply to the brain is disrupted and starts to starve the brain of oxygen. Strokes are commonly caused by a clot that blocks the flow of blood to part of the brain, but some strokes can be caused by a ruptured blood vessel that causes bleeding into the brain. If you suspect someone is having a stroke, you can use the FAST guide to identify the key signs. F stands for facial weakness. Look at their mouth and eyes. They might be droopy or can't smile evenly. A is for arm weakness. Ask them to raise both their arms. They may only be able to raise one, or one may droop or drift. S is for speech problems. They may be unable to speak clearly or might not be able to understand what you're saying to them. Ask them a question like, "What's your name?" and see if they can respond appropriately. T is for time. Write down when symptoms started and call 911. It's time to get to the emergency room. The FAST guide helps us recognize the most common signs and symptoms of stroke. Additional signs and symptoms of stroke can include disturbances to vision and vision loss, difficulty speaking or understanding speech, an abrupt and severe headache, loss of balance or coordination, one-sided weakness or paralysis. For any patient who may be experiencing a stroke, call 911 right away. Maintain a sense of calm, place the patient in a position of comfort, protect the patient's airway, and do not administer aspirin. Thanks for watching. To learn more about strokes, check out the American Stroke Association at stroke.org.